Hello, I'm Laura Siminoff, Dean of the Temple University College of Public Health, and joining me today are faculty experts Graciela Jaschek, Sarah Bass, and Krys Johnson. So things have definitely gotten better since we last talked at the end of June. Here in Philadelphia, there will be limited in-person dining, gyms are opening up, and other things that signal the virus is more under control. However, the virus still walks amongst us, and we continue to have to lead our lives a little differently. So we do now know more about the virus, how it spreads, and how to treat it. A lot of people are wondering if they still need to wear masks, and if so, when and where. To answer that, we need to understand the major route of transmission, which is through the air. So we're going to start this series with talking about how does the virus spread through the air. So Graciela, can you explain airborne transmission to us?
Yes, Laura, this is a very timely question since the CDC just updated their guidance to acknowledge aerosol spread. I'm going to talk about transmission in general, and then I'm going to focus on aerosols. So at the beginning of the year, we learned that SARS-CoV-2, which is the name for the novel coronavirus that causes COVID-19, the disease. So the SARS-CoV-2 can be transmitted through droplets and surfaces. That means that every time an infected person sneezes or coughs, they release droplets full of virus into the air. And if you happen to be close by, you may inhale the droplets and get infected. Hence, the 6-foot distancing and mask recommendations. The droplets generated from coughing or sneezing usually settle quickly. They are big enough, they settle quickly within 6 feet onto the ground or nearby objects. So hand-to-hand transfer from surfaces is also a possible means of transmission. Researchers later discovered that the novel coronavirus is quite fragile and deteriorates very quickly on most surfaces. So it is very important that we keep washing or sanitizing our hands, but we need to be especially careful about coming in contact with the virus while it is airborne. Researchers kept wondering, however, how the novel coronavirus gets transmitted by people who are infected but do not show signs of sickness. As many as 40% of infected people do not have symptoms of the disease and therefore are not likely to cough or sneeze, but they are infectious and they are still spreading the disease. Studies now indicate that very small droplets, called the aerosols, are released into the air just through normal breathing, talking, and even singing. So you don't even need to cough or sneeze. When you talk, you are releasing these aerosols. These aerosols can carry tiny quantities of virus that may remain airborne for several hours and travel really far. So if you stay in an indoor space for a long time without social distancing and wearing masks, you may inhale enough small aerosol particles to get infected. This is why it is recommended that you avoid going into restaurants or bars, nightclubs, or any crowded indoor event, and sadly also places of worship, because people who have COVID-19, whether they have symptoms or not, may release enough aerosols and droplets to transmit the disease to you.
I think that is really one of the better explanations I've ever heard. So thank you so much, Graciela. So now I want to talk with Krys. So it seems, and I think this is building on what Graciela was just talking about, it seems that we've all gotten the memo that when we're indoors in a public setting, we really should wear a mask. But I think there's a lot of confusion about outdoors. So can you explain when we should be wearing a mask outdoors?
Yeah, of course. So whenever you're outdoors and you're still going to be in close proximity to people, like whenever you're waiting in line at a walk-up window to get your favorite cheesesteak, or you're at a protest, you should still always be wearing a mask, particularly if you're going to be speaking, like ordering food or chanting at a protest, because like Graciela just said, just speaking can propel particles out. So you should definitely be wearing a mask then. Also, if you're on a crowded trail or in a crowded park and you're running or biking, you should still have a mask on. That also goes for if you're just on a narrow sidewalk. And we know that there are a lot of narrow sidewalks throughout the city. So just being very cognizant of making sure that you have your mask on, especially as you're passing people. But if you know that you're going to be consistently in your own space and have 6 to 10 feet away from people who are not in your household bubble, then you don't have to have a mask on. So if you've gone to a park to eat outside or just enjoy the scenery or the fall weather, then you can take your mask off. But you should always, always, always have a mask with you in case folks do get too close or you do have to speak to someone, a rogue ball that you have to return to another group of folks. You would want to make sure that you have that mask on. And then you'd want to have that whenever you're heading back to your car, because you'll be walking past other people who are enjoying the park or wherever you're at, or especially whenever you're getting on public transit. You'd want to make sure that you have on your mask, since that is also a mandate. So do keep in mind that the governor's mandate does say that you should have a mask on every time you leave home. So you should always at least have that on your wrist and ready to go whenever you're in close proximity to other folks.
So just to clarify, I live in a pretty densely populated neighborhood in the city. And, I see a lot of people, they're not wearing masks. I mean, maybe it's a time of day when there's not a lot of people out around in the neighborhood, but then they can rapidly encounter other people. The sidewalks are really narrow. And I find myself having to walk out into the street to take a big route around them. Should those people really be wearing their masks?
They should definitely be wearing their masks. And I was out in South Philly this past weekend, and I experienced the same thing. There were some very narrow sidewalks and folks who were running or biking for recreation. And because of how densely populated it was, they really should have had masks on as well, since it was such a narrow sidewalk. And I found myself doing the same thing, Laura, getting either as close to the building as possible or out into the street, like as protected by the cars, to make sure that I was giving them as much berth. Of course, I had my mask on, but those are situations where people should be more cognizant of having a mask on.
Thank you. And hopefully people will attend to that. Very good advice. So Sarah, let's talk more about masks, and particularly young people. So we all want to socialize, and we all want to have fun. So how can you explain to younger people about the need to wear a mask at a party or while socializing in a small group?
So, unfortunately, it's very hard to tell anyone, especially younger people, what might happen to them. Because we operate under the state of optimism bias, we tend to always think that things that might happen actually won't happen, at least to us. And this has kind of been exacerbated by COVID-19, I think, by two things. First, the longer the pandemic goes on, the harder it is for us to have a sense of kind of heightened risk. So if we think back to March, when people were buying out toilet paper and wiping down all their takeout containers, we had a heightened sense of risk. And that usually helps us cope, but also allows us to kind of be open to changing our behaviors to protect ourselves. The longer things go on, however, the harder it is to maintain that behavior, because we all want to get back to the kind of quote unquote normal state. And the only way that behavior sticks around is if it becomes rote and kind of habitual, which kind of leads me to the second thing. So the second thing, it has been this kind of lack of consistency in messaging around masks. We've kind of talked about this before, but I really can't stress how important it is. If we want something to become habitual, like mask wearing, the only thing that can happen, the only way that it can happen is if there's consensus and consistency in messaging. People have to believe that it's necessary, and even more importantly, I think that everyone is doing it, kind of that, peer pressure or kind of changing social norms that is very important in making a habit stick kind of from a societal level. And unfortunately, that's not the case here. So a few weeks ago, I talked to a reporter and I said that this was kind of like the Wild West of messaging. And I think it is really true. You have so many people talking. Many of them have no idea what they're talking about. And they're talking from multiple platforms. And when there are that many messengers and that many messages, people just kind of tune out and they just shrug their shoulders and you've lost them. So to me, it's really no wonder that young people are not seeing this as something that is going to happen to them, especially in an environment like being in college or during the summer when things are meant to be social.
I think that's a very good message. And that really wraps it up for today. So hopefully we gave all of you simple, clear, straightforward, consistent messaging. And if you want to see more videos, you can go to cph.temple.edu/coronavirus. We have other videos that are online and links to reliable sources of information. So thanks. And we'll be back in 2 weeks with another video.